The Rapid Response Team is an interdisciplinary group that manages sudden patient deterioration in hospitals. The following case scenario will guide a learner through the importance of each responder and how they work together to secure patient safety.
Anna is a 79-year-old patient who is currently hospitalized for right lower extremity edema. A rapid response was called due to shortness of breath. The first responder arrives to evaluate the scene in conjunction with a respiratory therapist, a resource nurse, and another nurse member. First responder evaluates patency airway and breathing effort with chest auscultation, use of intercostal muscles but normal auscultation, and assesses the patient's mental status, oriented in time, place, and person, but with difficulty talking due to shortness of breath. A nurse secured IV access and obtained vital signs: heart rate 120, respiratory rate 20, blood pressure 140/90, saturation 70% on room air. The respiratory therapist places the patient on a high-flow nasal cannula and obtains an arterial blood gas, ABG. After placing the cannula, oxygen saturation improved to 94%. At the same time, the second responder obtains relevant information from the chart, and the third responder notifies the family member by phone. The second responder checks the last note to see if the patient has a history of dysphagia, heart failure, COPD, or asthma. They also evaluate if there have been recent procedures, NG tube placements, pleural drainage, or a history of DVT. They check the main reason for hospitalization, see if the patient has been receiving deep vein thrombosis prophylaxis, and if there is any recent imaging. The second responder notices that the patient presented to the hospital after a transatlantic flight and refused DVT prophylaxis due to a fear of needles. The second responder notifies the first responder, and they decide to obtain a chest CT scan with protocol for pulmonary embolism. The resource nurse coordinated a fast trip to the radiology room. A few minutes later, the radiologist called the first responder to inform that Anna has a right-sided subsegmental pulmonary embolism. Both the first and second responders decided to start a heparin drip and touch base with their pulmonology colleagues. Access to this content and so much more can be found on the Just in Time Teaching Infographics app.